Introduction. I'm JLDI Academy AI Educator, an innovative platform designed to enhance the educational experience through the integration of artificial intelligence. I'm teaching first aid. First aid is the immediate care given to an injured or ill person until professional medical help arrives. This care helps to stabilize the person's condition, prevent further harm, and promote recovery. In this lesson, students will learn definition of first aid, understanding what first aid is and its significance. Basic principles, key principles like assessing the situation, ensuring safety, and providing appropriate care. Common procedures, techniques for dealing with common emergencies such as bleeding, burns, fractures, and choking. Practical demonstrations, hands-on practice for performing CPR, bandaging wounds, treating burns, and splinting fractures. Importance of knowing first aid. Safety, knowing first aid can help prevent minor injuries from becoming major ones. It teaches students how to respond quickly and effectively in emergencies. Emergency preparedness. Being prepared to handle emergencies ensures that students can provide immediate assistance, potentially saving lives and minimizing the severity of injuries. Confidence and empowerment. First aid knowledge empowers students to act confidently in emergency situations, providing help when it is most needed. Community contribution. By learning first aid, students can contribute to the safety and well-being of their communities, making them more resilient and supportive. Understanding and practicing first aid is a crucial skill that can make a significant difference in times of need, ensuring safety and preparedness for everyone involved. Understanding first aid. 1 definition of first aid. Explanation. First aid is the immediate care given to someone who is injured or suddenly taken ill before professional medical help is available. Purpose. The primary goal is to preserve life, prevent the condition from worsening, and promote recovery. 2 Importance of first aid. Safety. Knowing first aid techniques can help prevent minor injuries from becoming serious and can stabilize serious injuries until help arrives. Emergency preparedness. Equips individuals with the skills to respond quickly and effectively in emergency situations, potentially saving lives. Empowerment. Provides confidence to act in emergencies and offer assistance to those in need. 3 Basic principles of first aid. DRABC approach. Danger. Check for any danger to yourself, the casualty, and others. Response. Check if the casualty is responsive. Airway. Ensure the casualty's airway is clear. Breathing. Check if the casualty is breathing. Circulation. Look for signs of circulation, like movement or coughing. Assessment. Assess the situation and the condition of the injured person before taking any action. 4 Common first aid situations. CPR, cardiopulmonary resuscitation, used when the casualty is not breathing or their heart has stopped. Bleeding. Apply pressure to the wound to stop bleeding. Burns. Cool the burn with running water and cover it with a sterile dressing. Fractures. Immobilize the injured area to prevent further damage. Choking. Perform the Heimlich maneuver to dislodge the obstruction. Engagement tip. During this segment, use visuals like diagrams and infographics to illustrate key points, and provide real-life scenarios to make the content relatable. This segment sets the foundation for understanding the essential aspects of first aid, emphasizing its importance and basic principles. Basic principles of first aid. 1 Assessment of the situation. Safety first. Before administering first aid, ensure the scene is safe for you, the injured person, and others. Look for any potential dangers like traffic, fire, or hazardous materials. Stay calm. Keeping calm is essential in an emergency. It helps you think clearly and act effectively. Call for help. If the situation is serious, call emergency services immediately. 2. DRABC approach. Danger. Check for any dangers to yourself and the casualty. Only proceed if it is safe to do so. Response. Check if the casualty is responsive. Gently shake their shoulders and ask loudly, "Are you okay?" Airway. Ensure the airway is open and clear. Tilt the casualty's head back slightly and lift their chin. Breathing. Check if the casualty is breathing normally. Look for chest movements, listen for breathing sounds, and feel for breath on your cheek. Circulation. Look for signs of circulation, like movement, coughing, or normal breathing. If there are no signs of circulation, be prepared to perform CPR. 3 common first aid procedures. CPR. Cardiopulmonary resuscitation. Steps. Place the heel of your hand on the center of the chest, place your other hand on top, and interlock your fingers. Press down hard and fast, at least 2 inches deep, at a rate of 100 to 120 compressions per minute. After 30 compressions, give 2 rescue breaths if trained to do so. Bleeding. Steps. Apply firm, direct pressure to the wound using a clean cloth or bandage. If the cloth soaks through, add another layer without removing the first one. Elevate the injured area if possible. Burns. Steps. Cool the burn under running cool water for at least 10 minutes. Do not use ice. Cover the burn with a sterile, non-stick dressing. Fractures. Steps. Immobilize the injured area using a splint or padding. Avoid moving the injured part unnecessarily. Seek medical help. Choking. Steps. Stand behind the person and wrap your arms around their waist. Place a fist just above their navel, grasp it with your other hand, and perform quick, inward and upward thrusts Heimlich maneuver until the object is expelled. 4 basic first aid kit. Essential items. Highlight the importance of having a basic first aid kit that includes items like bandages, antiseptic wipes, adhesive tape, scissors, tweezers, and gloves. Explain that keeping a well-stocked kit at home and in the car is a good practice. Engagement tip. Use real-life scenarios and role-play to demonstrate these techniques. Visual aids like posters or infographics can help reinforce learning. This segment provides a detailed overview of the fundamental principles of first aid, emphasizing practical steps and safety measures. Practical demonstrations. 1 CPR cardiopulmonary resuscitation demonstration. Materials needed: CPR mannequin or a stuffed dummy. Steps. Positioning. Place the mannequin on a flat surface. Kneel beside it. Hand placement. Place the heel of one hand on the center of the chest. Place the other hand on top, interlocking your fingers. Chest compressions. Push down hard and fast, at least 2 inches deep, at a rate of 100 to 120 compressions per minute. Rescue breaths. After 30 compressions, if trained, tilt the head back, lift the chin, pinch the nose, and give 2 rescue breaths. Continue cycles of 30 compressions and 2 breaths until help arrives. 2 bandaging techniques. Materials needed: bandages, clean cloth, or gauze. Steps. Applying pressure. Demonstrate how to apply direct pressure to a bleeding wound using a clean cloth or gauze. Wrapping. Show how to wrap the bandage around the wound, ensuring it's snug but not too tight. Securing. Secure the bandage with tape or a knot. If the bandage becomes soaked, add another layer without removing the first one. 3 burn treatment. Materials needed: cool water, sterile non-stick dressing. Steps. Cooling. Demonstrate how to cool the burn under running cool water for at least 10 minutes. Emphasize not to use ice. Covering. Show how to cover the burn with a sterile, non-stick dressing to protect it from infection. For splinting a fracture. Materials needed: splint materials e.g. a board, rolled up newspaper or a rolled towel, bandages or cloth strips. Steps: stabilizing. Demonstrate how to stabilize the injured area without moving it unnecessarily. Applying the splint: place the splint alongside the injured limb. Securing the splint: secure the splint with bandages or cloth strips above and below the injury site, ensuring it is firm but not too tight. 5. Heimlich maneuver for choking. Steps: positioning. Stand behind the person and wrap your arms around their waist. Hand placement: make a fist with one hand and place it just above the person's navel. Thrusts: grasp your fist with your other hand and perform quick, inward, and upward thrusts until the object is expelled. Engagement tip: use visual aids like diagrams and step-by-step overlays to reinforce the demonstrations. Encourage students to practice these techniques under supervision. This segment provides practical demonstrations of essential first aid procedures, helping students understand and remember the techniques through visual and hands-on learning.